You're watching Reality Check. Just as we reach the end of a difficult, even traumatic year, the world now grapples with a new challenge of the Omicron variant of the coronavirus. The speed at which the virus is spreading is often outpacing the information about it. But to get a sense of where we stand at this present moment with the virus and how the world ought to respond, I'm joined by Soumya Swaminathan, Chief Scientist of the World Health Organization, who joins me from Geneva. Thank you so much indeed, ma'am. Always great to have you back on. Now, there is so much to talk about, so let me just start with a broad setting the stage question. The Director General of WHO, Dr. Tedros, said less than 24 hours ago that 77 countries have now reported cases of Omicron. It's spreading at a rate we have not seen with any previous variant. That doesn't sound like very good news.
Well, it may not be good news, but that's what the virus does. This is what was expected. It's entirely predictable, Vasu, and it was in our hands, actually, in the world's hands, to prevent this. If we had used the tools that we have equitably around the world, if we had enough vaccines to vaccinate people around the world, perhaps we could have reduced the chances of this happening. Anyhow, we are where we are now with the Omicron variant. And there's some good news and some not so good news, I would say.
Okay.
And I think 2 years into the pandemic, we have enough knowledge as well as we have the tools in our hands to be able to quickly understand what's going on and to update and strengthen the measures that need to be strengthened. And so every country, I think this is really a time, we have a few weeks to prepare before this surge starts hitting many more countries. And I think looking at what's happening now, particularly in South Africa and the UK, in Denmark and one or two countries, we can anticipate what is likely to happen in the coming weeks and months.
Right. That's a very important thing you said right off the bat, that this is something we could have actually checked if we had managed to get vaccines out in time. And I know that you, WHO, have been talking about vaccine equity for a long time, and I want to come back to that because that is crucial. But I do want to stay for the moment with, as you mentioned, how and where it is spreading. Just look, we'll put up those charts if we can. Look at how it is surging in South Africa and, as you mentioned, UK and Denmark. This is not all Omicron, but Omicron is powering this. Now, the UK government advisor, Dr. Susan Hopkins, said recently, Dr. Swaminathan, that they could hit close to 1 million cases a day by the end of December. Currently, it's about 70,000 cases a day. Million a day. That's massive.
And that's because the growth rate of this particular strain, this variant, is very, very fast. It's much faster than even the Delta, which we thought was one of the most transmissible variants that we've seen so far. So what they're seeing now is a doubling time of 2 to 3 days, which means if you start with 1,000 cases today, which is where, the UK was a day or two ago, you go 2, 4, 8, 16, 24, and very quickly you're up to 1 million. And this is what we call, the exponential growth. And if you look at some of the plots that have been charted, it's a vertical rise in cases. And this is what I think we have to prepare for. Once the virus enters the community, we can try and slow it down. Of course, we can try to contain it. But the chances are that with this kind of transmissibility, they've also shown that amongst household contacts, where the Delta had a secondary attack rate of 10%. So that means in a household, 10% of people got infected. This strain has a 20% secondary attack rate, which means that, everything that the Delta did, this one is doing better and faster.
Right. So this is all, of course, stuff that we're learning about the virus as we go. So one question clearly seems to have largely been addressed, that this is much more contagious, much faster when it comes to transmission. But the other question, which still remains a little unclear, is about whether it is more virulent and it is more deadly. Now, we're hearing some initial reports from South Africa that the proportion of patients requiring hospitalization for Omicron is lower than in the previous wave. Is this kind of, is this something that we should abide by, or is this misleading?
Well, there are a couple of things here. The first is that, yes, I think the reports from South Africa, they really very carefully documented what's happening there. It's wonderful because we're getting a lot of insights. So what they're seeing is that the rise in cases, which I said is, absolutely was very fast, was not accompanied so far by the same proportion of hospitalizations. Hospitalizations have gone up, but not as much as what they saw the same period during their Delta wave. So that's the first thing. Second is even people are getting hospitalized. They're saying that smaller proportion are needing oxygen and needing to be put into the ICU. Now this could also be, they've also said the majority of people in the ICU are the unvaccinated. Okay, so South Africa has only about 35% fully vaccinated rate. So I guess there's still a lot of unvaccinated, particularly younger people there. The third observation is that this wave is hitting the younger people more, maybe because they are the ones out and about. And that could be another reason for milder illness. So while we could, so far, and a lot of the people are vaccinated or in South Africa, as in India, have had previous exposure to the Beta and the Delta waves. So because of that, there's some pre-existing immunity in the population, either natural infection or vaccination, which might be muting this. Now, when this Omicron gets into populations that have less immunity, then and have older and at-risk populations, then what we see might be different. So I think we have to wait a few weeks to, but the initial signs are reassuring, but again, it's if you have enough numbers infected, then even a small proportion of people who are sick can end up filling the hospitals very quickly.
Exactly. That's right. I mean, as we saw it with Delta and the second wave, that even if the actual fatality percentages are small, 1 or 2%, the overall top line number is so big that you'll still have crowded ICUs and much worse. But as you said, let's wait to see how that plays out. Now coming, of course, to the big question about, whether the vaccines are providing immunity or not. And if you look at the countries where it is surging, percentage of fully vaccinated population, South Africa is low, only 26%. UK and Denmark is high, 70 to almost 80%. What are we learning about Omicron and vaccine immunity?
Okay, so again, the knowledge here is evolving on a daily basis, but I think we know a few things by now. First is that because of all these mutations that it has, it is able to evade our immune response, the antibodies that we have generated either because of vaccination or natural immunity. So reinfection is much more common. And this they saw in South Africa even very early on, that reinfection rates are 3 times more common than Delta. The second thing is that they have also looked carefully to see what vaccine effectiveness against people who've been vaccinated with 2 doses of Pfizer or 2 doses of AstraZeneca are looking like. And it does seem that those vaccines that were providing, 60, 70% protection against infection, symptomatic infection, that's now down to 30% or even lower.
Yes.
However, the most recent data that has come out shows that protection against hospitalization has dropped. It was above 93% with 2 Pfizer doses. It's down to 70%.
Yes.
We don't have that figure for AstraZeneca, but this is the critical thing. You can look at it both ways. I think we can be happy that vaccines are still providing protection against severe disease. 70% for 2 doses of the BioNTech Pfizer. We don't know what it's like for 2 doses of other vaccines. We need to find out. On the other hand, we could say, well, that was 90% and above, and now it's down to 70%. Vaccine immunity does wane over a period of time.
Sure.
We had said that this protection against severe disease lasts at least up to 6 months for the Delta variant. Now, the Omicron is able to overcome that immunity even at a even shorter time frame. So this is why many countries are now going ahead with boosters. We need to think about, again, how do we protect our most vulnerable? Is it going to be through additional doses of vaccine, or is it going to be through other measures or a combination of things?
Right.
It not depends, of course, on the availability of vaccines.
Yes.
But also on generating our own data to see, where we are. big
Right.
figures like hospitalizations,
Okay.
breakthrough infections.
No, those are important points. I think you were referring particularly to this latest study from the UK, which was looking at how 2 doses protection drops 65% after 3 months for Delta, and it's just 35% or so for Omicron, which is a huge jump. And booster effectiveness has fallen
There's a
from
study from the
95%.
UK.
Yeah, 95 to 75%. But overall, again, Dr. Tedros, I think you're also saying the same thing. He said, we lack evidence for the effectiveness of boosters. You're not against boosters, but we don't fully know if boosters will work. But would you say that given the risks involved, it is important to now just go ahead with boosters?
I think the discussion around boosters needs to be quite nuanced.
Okay.
As Dr. Tedros said, WHO is not for or against boosters. We want to protect people, and we have to do whatever it takes to protect people based on the emerging data and evidence. Now, what countries that have done boosters quite early on, like starting in July, Israel was the first, and then the US and UK been rolling out boosters. If you look just at the neutralizing antibodies, they do start declining. Even after a booster, that's the third dose, in about 10 to 12 weeks, you'll again find a decline in neutralizing antibodies.
Right.
However, immunity is much more holistic and complex than just the neutralizing antibodies. And it's believed that the T cell responses, the cell-mediated cellular immunity, that is likely to last longer. And apparently the mutations on this variant, Omicron, have not affected the T cell immunity as much. So I think that's a good news because that's the immunity that protects you against severe disease. Now, the older you are, the more likely that immunity will wane, because the body is not able to generate that many cells as a younger person does. Mm-hmm. And so it is possible that in people, particularly over the age of 70, that they may need a booster dose to increase that immunity again, make sure that, that they're again prepared to face an infection and fight it with their own immune responses.
Okay.
So people at particularly high risk, I think, might do well with the booster.
Okay, but just to simplify it, because for those watching, both just the ordinary public and governments, I understand what you're saying. It's a little nuanced about boosters, but then 3 steps governments should be taking. Is it of course obviously to make sure that you're vaccinating, you're expanding your vaccine rollout, but what else should governments again be considering? Lockdowns, travel restrictions? What's the crucial playbook to check Omicron?
So, we have a combination of these, what we call public health and social measures, in addition to vaccination. So as you rightly said, it's a really big priority just now for every country, every government to vaccinate as many people as possible, starting with the most vulnerable and high risk, because we know that it may not be 100% or 90%, but even 70% is better than no protection, right? So we have to get that protection into people. That's 2 doses of the vaccine.
Right.
So that it definitely needs to be done in a big way. I think, again, of all of the measures, we know, for example, that mask wearing, universal mask wearing, is a very effective intervention.
Right.
So is diagnosis and isolation of cases and contacts. Now, when the numbers get too big, it becomes very difficult to do that. When the numbers are still small, one can do that. We need to keep a very close eye on the numbers and track not only the growth of Omicron, but track the test positivity rate at the district level, the number of cases. Look at clusters, are there more clusters that are happening? And then start taking some of the measures, like ventilation is really important again.
Okay.
Particularly as a lot of indoor settings have opened, we need to look at the air conditioning settings. Are they good enough? Are they generating enough air exchanges per hour up to the standards? And wherever possible, open air. Avoid gatherings. Again, people have started gathering in large numbers. So whether it's social, cultural, political events, sporting events, we really need to keep that down, because those are things which allow the virus to spread to a large number of people in a very quick time. We've heard about these Christmas parties in Norway, where 1 or 2 infected people, it led to 120 people getting infected over just a couple of hours. So that's the transmissibility of Omicron. So I think everyone needs to put their guard up again. The next few months are going to be critical.
Absolutely, especially as, heading into holiday season in Europe and the West. But so that's what governments, that's what countries ought to be doing. But let's look at what they are actually doing. And this is coming back to your point about vaccine equity or inequity. This is Dr. Tedros putting out the information. Vast gap in rates of COVID-19 vaccination between countries. 41 countries still haven't been able to vaccinate 10% of their population. Only 98 countries have reached, or 98 countries, have not reached 40%. And of course, inequities within the country. Come back to what you were saying about how this could have been stopped if we had done a better job of getting vaccines out there. What went wrong?
Well, what went wrong can be described in many ways, including vaccine nationalism. People have used even stronger words. I think every country's leaders wanted to protect their own people, which is perfectly understandable. But in a pandemic, you also have to keep this in mind, that if you're not protecting people around the world, the virus is going to change and come back in a different variant, which is what WHO has been saying from the beginning and which is what's been happening. I think at this point, there is a lot of global production of vaccines. I understand something like 1.5 billion doses are being manufactured, and some companies probably can do even more. Now, if a few countries again start booking these vaccines and almost hoarding them, thinking that they will boost their, some companies CEOs have talked about 4th doses. And if that goes on in a few countries, today I think booster doses are 8 times more per day than the primary doses. So you can already see this happening. And we're going to get back into this cycle where a few countries are vaccinating their populations, but then the virus is circulating and transmitting and creating new variants and then coming back to infect the countries that were vaccinated. Look at the way Omicron has developed. It's able to now overcome some extent of our immunity. So this is why I think we need a global plan and global solidarity. And so far there's been a lot of lip service paid to this. There are, of course, also challenges some countries have in administering vaccines. I think India has a very strong history of and a very strong vaccination program built up over many years. But adult vaccination at this scale is the first time the world's trying to do this. And there are many countries that are just not able to do it. They just don't have the systems. And so they need support. They need funding.
Yes.
And they need the supplies to come in a predictable supplies. And now we have to also look at whether we're going to need a different type of vaccine or vaccines. And so while manufacturers are already trying to develop Omicron-specific variants, the WHO is looking at all of the evidence and hopefully in a few weeks we'll be able to make a recommendation on whether we'll have to move some other kind of either a more broadly acting vaccine or Omicron-specific vaccine. People are working on pan-coronavirus vaccines that have protection across the board. So there's lots going on in the research and development side that we also need to keep an eye on and provide guidance.
I take your point about the challenges of vaccines. Of course, developing new vaccines that can combat Omicron is one part of it. But the bigger challenge, of course, as you said, is to make sure that vaccines reach everybody. I mean, look at South Africa. I mean, we saw, all the public health officials coming out and saying we didn't get the vaccines in time when we needed it. And they've emerged now as one of the hotspots. Are you seeing any change are you seeing particularly the wealthier, well-stocked countries, are you seeing any shift in terms of being able to get vaccines to where they're needed? Or is that problem still a problem?
I would say it's still a problem. The United States has made a massive commitment of a donation of 1 million BioNTech Pfizer vaccine. And many other countries in Europe have made smaller commitments. Some of those donations have started flowing through, but not at the speed at which we need. I think December was the month with the highest shipments of vaccines out of COVAX. We were 150 million out of the door in November,
right.
and a little bit more than that in December. But that's not enough to vaccinate, the population, which is still about 40% of the world's population still hasn't got even a single dose.
Right.
The other thing is looking at within country inequities, and I want to make that point because even in high-income countries, there are still a lot of people who are unvaccinated, and in the US, for example, they've sort of hit a plateau at about 60-62%. And this is particularly the marginalized, vulnerable groups. Of course, there are also people who don't want to take the vaccine, but I think they're a minority. The majority are because they're not able to access the vaccine for one reason or another, or they have genuine doubts. So every country needs to start looking at their populations and really looking at who's still uncovered and why, and addressing those through a lot of communication strategies and behavioral and very local interventions that can increase the vaccine uptake. Because that's true for high-income countries which have not achieved adequate levels of vaccination,
sure.
as well as, of course, low-income countries which face many more challenges. There have also been vaccine hesitancy that's been fueled by some of the actions taken in some countries where, there was a lot made of side effects and those countries stopped using some vaccines for some age groups. All of this now, of course, the messaging goes around the world and people then start losing confidence. But overall, I would say that in Africa in particular, governments have really struggled and have sort of lost confidence because they've seen a trickle of vaccines coming through, and their populations, I think are tired of waiting now for the vaccine.
Right.
So we really need to step this up in 2022.
Well, let's hope that that just the fear or the alarm bells of the Omicron advent is going to actually knock down some of those walls of hesitancy. But last quick word from you on India, because when you talked of low income, India, interesting paradox. We have a huge stock, initially faltered with the vaccine drive. Now it's picked up. But actually, again, it started to sputter out. So from not having enough vaccines, we are now in a position where the numbers have started to fall. I think it's only covered about 30-35% of the entire population is covered. So there's a large number of people who need their second dose before we even start getting into boosters.
Yes, of course, the numbers in India are so huge and massive that it is a huge logistical challenge. But I think the efforts that are now being made, as far as I can see, to really try to get second doses into people, that's going to be very, very critical. And as I said, I think interventions at the local level,
right,
whether it's, urban low-income areas or whether it's remote, rural and tribal areas, I think the local administrations, really addressing the issues and challenges which might be stopping and preventing people from getting their second doses or even their first doses.
right.
I think it's very important, particularly tracking those above the age of 45 and ensuring that we cover as many as possible in the next few weeks. As I said, we have a window of
right.
opportunity now before Omicron sort of, gets in and starts having a community transmission.
Okay.
So this is the time to prepare and also prepare the health systems. I know a lot's being done already, but this is the time to make sure that logistics on oxygen,
sure.
supply, that drug stocks are available. There are now new oral antivirals. Those can only be given if we have access to diagnostics. So we have to remember that the drugs to treat COVID are only useful if you have very early diagnosis. So a lot of testing needs to be ramped up as well.
Okay.
As well as, of course, genomics. But I think diagnostics, we need to make sure that there's adequate availability everywhere across all districts.
Right. So, no, that's true. So there's a lot to digest from what you said, and also a lot on the plates of governments as they now grapple with this latest challenge. But thank you so much for joining us, Dr. Swaminathan. Great to have you on as always. Thanks very much.